Today I'm going to talk a little bit about both technique as well as how to see and think differently and how I've evolved my thinking. So some of these things have just been sort of thoughts that I've progressed over the years, and I think to start with we have to see differently and build a new vision of how we see the face before we can actually just put fat in there. With that there's going to be artistry, and with that there's going to be safety. We're going to highlight some of those points. When you look at Sharon Stone over a period of 20 years, it looks very obvious that there is some kind of gravitational component. That clearly there are skin changes, but how much gravity exists? If you look at the brow, especially the one on her right, that is on left when you're looking, you can see that the brows look like they've fallen, but they haven't fallen barely anything. And if you look at the skin, has fallen a little bit also on the right, but if you look at the left, both have sort of gone up a little bit. So there's not a net fall. It's actually, if you look, it's an involution, and so there's a significant involutional component. We're not saying that there's no gravity, but I think gravity has been overplayed. So this is truly a volume loss. If you take a narrow time frame of Heather Mills in her early to late 30s, and you look very carefully and adjust some of the changes in the position of the photograph, you can see that really what's going on is that there's just more hollowness around the eyes, the cheeks, and the jawline. It's not necessarily a deepening nasolabial groove or a flattening lip or any of the landmarks that we attribute to aging. So in the effort of communicating with patients, what I always try to do is use language they understand. And so I talk about a glass of water that empties. And if you think about what happens over time, we actually have that glass of water too full when we're younger. And if I ask a lot of women what they liked when they were younger, they oftentimes don't tell me, oh, I liked myself at 18 or 20, which we may think is an ideal age of youth, right? Most women tell me early 30s because during the phase of aging, or phases of aging as we progress, we go from almost too much fullness, which we attribute to something called baby fat. And baby fat isn't some distinct entity. It's just a linear loss of fat from birth to death, where we go through a point of ideal and then we continue to hollow, minus obviously weight gain that it can occur in a middle age. So I explain it this way, and so people always ask, is fat grafting permanent? We'll discuss that more in terms of another concept in a few moments. But we're almost too full. We go down, and what my goal is to fill it up in the yellow, okay, to wherever you are, starting point, but each year you lose a little bit in the pink. So you're going to lose a little bit every year as you continue, but you will almost always be better off years later with the fat transfer. I think what's really important is, besides focusing just on sort of technical, we're going to integrate that in a moment here with this concept, but also to see differently. And one thing I've really been focusing is on the mid-face. And when I say mid-face, I don't mean anterior cheek. A lot of people go in there and they just stick Restylane in there, or they just stick fat and there's a ball of fat. I'm talking about really contouring the entire cheek to buccal zone as one complex. So let's go through a few case studies. Oh, sorry, I'm going to do that in a moment. So let's talk a little about changing shape as we progress. There's an evolving shape change as we go from youth, and we see this fullness of a circle as we progress forward. And so you see at teenage years, even though the body may be very thin, there's still relatively roundness to the face. Even in the early 20s, there's a very round feeling to the face. And as you continue, there's a slow transformation where you can instantaneously, in a blink of an eye, even 20 feet away before you see a wrinkle, recognize someone's age based on two things: shadows and transitions, which we'll talk about more in a moment, and also shape. And so these shape changes are so much more critical. Oftentimes when women come to you, they come with an 8x, 10x magnifying perspective of their face, and they look at themselves too closely. What I always want you to do is look at yourself from a distance, and that shape change, that blink effect, that immediate, oh my God, you look great, is what we're trying to achieve here. So we start to continue to narrow in, and sometimes in the early to mid-30s, that can be more of an ideal oftentimes, and you can see the shape that's there. So bringing old photographs can help a woman and you relate better and understand which may be an ideal shape she's trying to achieve. And then as we start to have lower dominance, which really to me doesn't mean in the early 40s a gravitational component, but continued loss of volume and exposure of bone, you get a squaring effect, which is masculinizing an attribute. And it continues to invert, and with lower dominance and with continued evacuation of the upper face, and sometimes that's contributed as well with some weight gain as you mature. And complete cadaveric component to the upper face, it can occur where it really becomes lower dominant. So a lot of what you think we should do here is converting it to a triangle, inverting the triangle. But I like to talk about ovals because I think that's a more elegant shape. And so this is what I was referencing earlier, is designing faces that have an oval shape. How long does fat last? It's permanent. We've heard this earlier. Why is it permanent? I try to think about this because is it just some kind of scar tissue that it forms? No, because fat can be dangerous as well. We'll talk about some of the dangers of fat. It's not just this glorious, perfect modality for everyone at the end of this talk. The longevity, I was studying for my hair boards, and I started to think about it, and hair transplants build over a period of about 2 years. And why does that occur? Because it takes time from primary inoculation, secondary inoculation, all the way to neovascularization, and I see the same thing with fat. Fat's results, if you study the results, get better, except for some of the early edema that can be false and misleading, over a period of 1 year to 2 years in the majority of patients if you have good take. Is it a perfect take? No. You're going to have areas you'll be slightly disappointed. There's no way fat is that predictable. But if you cover the whole face and all the little areas of aging, you'll have a result that really looks soft and attractive. So this is what I call the dip. So somewhere between 3 to 9 months, there's a period of time where the fat just doesn't look as good. And that's something that you have to warn patients on. Give it time to mature. You don't have a hair transplant come back in 3 months and go, wow, how come you didn't grow? That's too early. You have to think of it differently. So here's a lady at a week, very puffy and swollen, and she comes down at a month. And sometimes a 1 month photograph is a bit misleading because all the edema is stretching everything out, and you think, wow, that looks great. And then 3 months, maybe things settle down a little bit in her case and looks better because she needed a lot of volume. And then at about 6 months, maybe less impressive, but still pretty good, and it starts to build a little bit more, and I didn't put more fat in, I didn't put Restylane in. This is just an evolution of change that occurs over a period of time with weight consistency. So this is not weight gain. Donor dominance, a point that I again was thinking about hair and translating from that world into the world of fat. And what donor dominance is the idea that when you transplant hair from the back of the head and move it forward, it retains the genetic characteristics of the hair in the back. Well, fat in the belly is very different from fat in the face. So you have risk and you have benefit. What is the risk? Well, if you gain a lot of weight, the face can look really puffy. And patients ask, what's the risk of fat in your hands? Is it lumpy, bumpy, absorption, terribleness? And generally, no, it's not. The risk is significant weight gain on your part. It's underlined in all my preoperative counseling. It's during my consultation, and they understand it. And that's the thing that I've had about 3 or 4 patients that gain 30 or 40 pounds, and they don't look good. And they've lost the weight, and fortunately, one still hasn't quite lost it, but they don't look as good. So you got to be careful with this. And I also find that fat is relatively resistant with minor loss of weight. So when patients are coming into me with a preoperative weight that's a little higher, and they go, I want to lose the weight before I do fat, I say, don't do it. Lose maybe a little bit of it, but be a third down on your target. Don't go all the way down until you're bone thin, because then your risk of weight gain is more significant. So we always talk about, are there things that I can stick in my fat to make it last longer and make it work better? And for me, in my hands, I don't want to do that. I'm not saying you shouldn't do that. I think if you're starting out and you don't know exactly what volumes you're putting in to get what kind of results, then I think that's great. I fear not too little fat. I fear too much fat. And those results look horrible. So if you look, I don't want anything better. I don't know if I want anything better. I want things, and sometimes do I undershoot a little bit? Sometimes am I a little disappointed? Yeah, I can always have more fat, but I can't take it out. So always be conservative and caution yourself whether you want every new modality to improve your fat take. Always start conservatively. How do we read faces? This is something, again, in my evolution of thinking, I always looked at how do faces change. And it's light. It's how light is on the face. So it's how light strikes it, and it's completely the way we read a face. And how do we see the world? We don't look like this, clearly. Sometimes we do. We see sometimes, when we're in the bathroom at 7 p.m. we look bad. But the reason for that is a lot of times what happens is that light strikes downward, almost in all contexts. So when we take photographs and we blur it out with big fill lights and flashes that go in, I think we do a little bit of injustice, but you don't want this overhead light that's shadowing like crazy. You want a uniform overhead light that mimics real-world scenarios, and you compress your photograph room to a very small space so you don't get too harsh a light casting down. And that will accentuate your volume results so you can see them. Otherwise you can't see them. They're blurred out with fill lights. And so think about how light strikes the face in a normal setting. There's no flash in it. It's all top down. So when you are deflating, that's why you see the transitional shadows that are there. And inflation really creates the shadow, it minimizes the shadows. And so what I'm always looking at when I'm doing fat grafting is how am I going to accentuate diminish the shadows and diminish transition points. When do I use implants and when do I use fat? Why would I do one or the other? And we go back to this concept of loss of fat over time. And if you think about volume loss over time, is it a lot of bone loss? Not really today. Maybe during the Civil War time, we lost a lot more bone. We do lose some bone, there's no doubt. But we lose a significant portion of our soft tissue envelope. So the question is, why should we put hard implants to replace that? Clearly, if you're getting great results with hard implants, then ignore this. I mean, there are many ways to skin a cat. This is just my interpretation of aging and how I have my patients understand it. So with aging, there's a greater loss of soft tissue envelope over the hard tissue. And if you put an implant in there, there's greater risk of more bone exposure. And we're trying to diminish the bone exposure because implants are hard, fat is soft. So what is maybe more of an ideal? In my opinion, fat transfer can restore that differential between soft tissue and hard tissue exposure. Same thing you see here is hard tissue exposure. So I really believe that if you do selective implants, unless you're putting implants everywhere, then you're creating more transitional elements of the face and more bone exposure, which are the two things you're trying to fight as you age. My general decision tree here to help you with how I see this is that older people, fat grafting to me is fantastic, so long as that they're stable. If people are younger, if people are in their 20s and need volume, I usually use Restylane, or I'll use an implant in the right context. So those are the ways I see things. Stem cells, that's a big topic. We're going to hear a little bit more about it. I think the jury's out. I don't have any insightful comments to say, oh, it's definitely there or definitely it's not there. I try to undersell that to my patients because I think it's a marketing buzz that I don't want my patients to think, oh, you're going to have this magical change in your skin. But I think it probably is there. There's a high concentration of stem cells, and we're going to hear that from Dr. Metzinger in a short time. The thing I leave you with is, as surgeons, we are very left brain. And I want you to think for a moment and use your creative right brain and look at a gestalt of the entire face. Thank you.